Welcome. I want to thank you for joining us for this week's cross-industry Safer at Home weekly update with Boulder County Public Health. Thank you for joining us and for continuing to join us to get your questions answered, to get updates, and to receive the information you need to have safe reopening practices in today's economy. We're doing this for our health and for our economy. Let's get right to it. And we see that Jesse has an animal on his lap this week, so we have a new presenter this week. I'm going to hand it right off to Jesse Rounds with Boulder County Public Health.
Thanks, Corinne. She only cares about fish, so I don't know if anybody has any questions about fish, but that's all she cares about. So I just jumping in, we're going to do what we do every week, talk a little bit about the case updates, the epidemiological details, and then jump right into some of the details about public health and mask orders, and then go to questions. And I appreciate everybody's time today. So I wanted to throw up this chart because, and this is one I don't think we've shared before, but it's part of our weekly, our epidemiological team does a ton of great statistical work. And this is one of their charts where they're tracking the 7-day moving average for all of the counties in the metro area. And over the last couple of weeks, we've been in a really good position. We sort of had this big peak where we were not doing very well. And then we were one of the lowest counties in terms of new cases. But unfortunately, in the last couple of weeks, that has changed. Boulder County's 7-day moving average is now 7.4 cases per 100,000 people. And this is our 5-day moving average, just looking at our county alone. And the 5-day rolling average is, and this is through the 7th, so Monday at 2 p.m. Was 26.8 cases per day. And so obviously sorry, I need to be louder. Thanks, Corinne. And you know, the issue there is obviously the 5-day average is a little bit less or a little bit more sensitive to peaks. But that also helps us understand where peaks are coming from, when they're happening, and try to understand that in the larger context. But I think that the important information here is we're seeing an uptick. We had weeks and weeks of lowering cases, new cases, and that was great news. Even after the students came back, we continued to see lower cases, but unfortunately, that has turned around. And a lot of that has to do with the return of college students. And that is unfortunate, and both public health and the city and really CU itself have been working together pretty well to try and address this. We're really trying to get at what can we do to reach out to college students to affect their behavior. Because we're, you know, unfortunately, while college students are getting it because of community spread, the communities that are affected disproportionately are groups like the Latinx community, which continue to see disparities. And if we see rising cases, it falls heavily on that community, and that is not a great situation. Our one positive light right now is that we are still seeing low 5-day PCR test positivity. It's much higher than it was before, which makes sense based on the number of new cases. However, it does bode well. We're trying to stay under 5% positivity, and we are staying under that. So that is a good sign. So just some updates, and these are the same updates that Lane provided last week, but the City of Boulder has updated their mask order to be in alignment with ours, which is in alignment with the state, except for the outdoor part, which we've discussed in the past. And then the City of Louisville now has lowered the age for those who need both indoors and outdoors to be wearing masks down to 3. So they're stricter than the state and the county. And it's just really important that those businesses that are located in Louisville, those of us who do business in Louisville, need to be aware that the mask order in the city is stricter. In terms of the mask order, nothing has changed at the state level. You still need a sign at the front of your business letting people know that masks are required. And you should be, and we encourage you to look for alternatives for those who can't or won't wear masks. You can deny service to folks who won't wear masks and can't wear masks. But we really encourage you to look for alternative ways of providing service to those communities, whether that be curbside pickup or online ordering or whatever that might reduce contact. I added this slide in this week because I think this came up at the end of, at the end of the school year last year, or last school year, earlier this year. One of the things that businesses were looking at were, a lot of local businesses employ CU students. And at the time, we were talking to businesses that were having trouble talking to their student employees and trying to communicate to them that it was really important that they look at ways to protect both their customers and their other employees. And I just want to encourage everyone to talk to students if you employ them. Let them know that their fellow employees, the customers, really rely on all of us wearing masks, washing our hands, social distancing. It's just another point, a contact point we can have with students to really encourage them to think of the community at large. Also, and this has been something, I was not in the call last week, and I was traveling around to some other states and looking at the various levels of mask compliance and mask orders in those places. And I just want to remind you, if you are indoors in a public space, please wear a mask. And remember that a public space is anywhere that's not your house, essentially. If you're in an office, if you're delivering things to the back of a store, that's a public indoor space. You need to be wearing a mask. And then just a public service reminder, wash your hands and social distance. Those are the ways that we can really impact this positively. The Protect Our Neighbors metrics, I include these mostly because I think it shows progress, but I really do want to remind people that just because we achieve Protect Our Neighbors status doesn't mean it's necessarily a good idea for us to apply to go there. It doesn't mean that public health will decide to do that. We're looking at these as a good way to track our progress towards managing the virus, but really any changes in our status are going to have to be viewed as what's the best thing for the health of our community at large. So I just want to remind people that the Protect Our Neighbors metrics are there for really a measurement at this point. Other than that, I don't really have anything. Just want to remind everyone this week, at this time every week, we have these general update sessions, and we have no session this week at 4 p.m. However, next week, we're hoping to do a session for houses of worship. So if you are interested in that or know anyone who is, please reach out to them and let them know that we are going to be holding that session. And then again, the Spanish language session in collaboration with the Latino Chamber is released on Thursday. It's recorded in advance, but they take this presentation and sort of mold it based on questions they've received during the previous week. And it's a really great session. So I encourage you to listen in if that's of interest to you. And then finally, just if you need to get in touch with us, please email us at covidbiz@bouldercounty.org, or if you have a complaint or concern, you can call the call center 9 to 2 p.m., 9 a.m. to 2 p.m. At the number there. So with that, happy to take questions.
Okay, so you've actually seen this question, Jesse, because it was emailed to us right after the last session. This is from Unlimited Healthcare, but it could also be personal services or some of the others. But This company is thinking about suggesting that all their therapists get a COVID test one time a month. They're hearing about possible exposures and not sure what to do. Each time they get a notice, it kind of affects their business. What are some suggestions? Is that a recommendation? Is there any requirements? Are there any places for healthcare providers or anybody to get free testing?
So lots of great questions. There is no requirement that employees get tested on any regular basis. In fact, I think you want to focus your testing on a reason. If you have a reason to go get tested, that's perfectly fine. I know that a lot of businesses are looking for free testing, and those services are available. I also encourage you to check with your insurance provider. Some insurance providers are looking at this as a positive thing for overall health to provide coverage for testing. In terms of issues with businesses and hearing about positive tests, I really just encourage you to keep in communication with your customers, your patients. Let them know what precautions you and your staff are taking. Have you increased hand washing requirements? Have you increased the number of times you clean the space? Are you providing additional PPE, things like that let people know that you're aware that there are ways that we can reduce the impact of the virus in these offices where definitely there are lots of people. So transmission is possible, but if we take precautions, the chances are reduced. I don't know, Elaine, if you have anything to add to that.
Yeah, I think there's another question that touches on this as well. I think in general, having people testing to show that they're negative isn't necessarily the security that you may think it is, because we have an incubation period that can be up to 2 weeks based on exposure. So people may not test positive, but they might test positive a day later. So getting negative tests isn't necessarily the best, that gold standard. So really, we really want to limit testing to when people believe they have been exposed and are concerned that they are positive and potentially not showing symptoms. So I think really just the overall screenings for employees, the health screenings is something that we do want to see people doing, but just routine testing may be incurring an expense without giving you really the benefit that you may hope it has.
That's a really good point. And I would also, just to reiterate the screening questions, taking your employees' temperatures, letting people know that you're taking your employees' temperatures, don't release the information obviously, but letting people know that you're doing that screening is a really big step, I think, towards providing some comfort. That's a really good point.
So the other question that Lane was referring to, and this person asked it twice because they switched devices, but is it permissible to require a negative COVID test as a condition of hiring? And I know that we've sent out the EEOC guidelines in the past, and so that's kind of the question. Now your answer is about whether or not, about testing in general, but this question was about, is it permissible to require a negative COVID test or to require COVID testing as a condition of hiring?
Yeah, and I think for that, we would definitely push you back to your legal counsel, your human resources folks, of whether legally you can require that. We would not necessarily encourage that. It's not really a best practice, again, for those reasons of getting a negative test doesn't mean you won't be positive the next day. So again, it's a false sense of security potentially.
And we covered this in a previous webinar, and this falls back on the ADA requirements. And so I'll resend out the EEOC guidance that we've sent out with the equal employment opportunity laws, that under COVID, they've been revised to talk about when mandatory medical tests can be administered and where COVID-19 tests fall. And then you can also reach out to someone like an employer's counsel or a legal counsel to talk about where this fits, because it is HR law. but that does fall under that EEOC guidelines, and it is answered in those guidelines that we've sent out previously. Okay, if you share an office building with tenants, does the 50% threshold, and we're talking about office, the office and manufacturing thresholds, count all humans in the building, or is it each space held to their own 50% threshold if they can't socially distance?
And I don't know, I'm going to look. Lane, do you know the answer off the top of your head? Because I'm going to take a look.
It's probably a combination depending on how the space is used. So there's, it's all those are maximums. So again, 50% occupancy, assuming you still can actually socially distance and accommodate that number. So typically though, if they're saying tenants being, there's a lot of different businesses in one building, they may have different functions. You might have a limited healthcare in one, you might have some other kind of service, a field services office, a retail. So each one has its own sector that they should be focused on. And then I think generally the general spaces would also have sort of a threshold maximum so that you wouldn't have too many people all in common areas where there's a shared bathroom or things like that, shared elevator spaces and things like that. So it's probably some combination of the two, and depending on what that building specifically is being used at, we might be able to dig into that question a little more.
But in general, if you're looking at office spaces, you want to be at 50% the capacity you're normally at in an office space throughout the building.
Yes. Yeah, that's the maximum for an office space.
Mm-hmm.
And when we looked at our building, for example, so we have multiple people within the building, we kind of coordinated with our other tenants. So if they're bringing in more of their staff, we're not going to have as much of our staff in, and we're not counting meeting spaces. We're just counting the space where people are actually physically in their spots. We're going to have 50% of the people in those spaces, at any or less at any time.
And if the whole office building is made up of tenants of office spaces, each space should be at maximum of 50%, and then therefore the building also should be a maximum of 50%. So it's kind of sort of both.
And we also look at guests for the day. So let's say one of us has a meeting with like 2 people. That's going to take some of our space. So we need to make sure that we're not at our 50% with staff that day. So it's going to be a little bit of a coordinating action because there's a little bit of juggling going on when we're looking at the use of our space. All right, so are businesses required to provide masks in the event that guests do not have one?
They're not required. It's a service that you can provide. Make sure that they're clean and reusable, not reusable, one-time use pretty much. But no, there's no requirement that you provide masks for people if they come in.
Just your employees.
Yeah.
You have to deny service or someone to enter your facility if they don't have a mask under the mask order, correct?
Yes.
So if you aren't providing one to someone, they're not going to be able to enter. So can you talk a little bit about the virus and the work being done about the water testing? I think people read a little bit about what CU did with the wastewater testing and some of the indicators they found in the wastewater testing prior to any positive tests within the students.
I really don't know much about that, Lane. I don't.
Yeah, I don't know a ton either. It's a tool. It's not intended to pinpoint who is sick. It's giving them an idea. Are there potentially problems in their dorm spaces? So that's just one indicator that they may need to look to see if there are ill people within those dorm spaces. Again, to stay ahead of getting to an outbreak situation where there's lots of ill people. But I don't have a ton more information than that.
think there's a couple universities, University of Arizona, University of Colorado. They're using some of the science they do on campus to do some early indication testing, and then using that early indication to lead to notes to the students to ask them to make sure that they go in and do both the saliva and the PCR testing. Can you explain some of the, do you have any information on what caused our recent bump in numbers? Where did those number increases come from? Were they from students? Were they from, you know, businesses? What's going on in our community causing this increase?
I mean, the information we received from our epidemiological team is that the biggest source from the last bump was students testing positive. However, there are still people in the community testing positive that appear to be independent of the student body. So it is, you know, it's a case of community spread out there. You know, that hasn't changed. But yes, the largest bump came from student tests.
Yeah, it was 69% of the new cases were among college students. So that was the big piece.
Okay. So somewhere last week, there was a news story that the state is planning to introduce a new dial showing at which level communities are at. Do you have any more information on what this is? Like, it seems that they were asking for public comment, but it didn't seem well publicized. What should we expect to see from the state on this, or is this going to be a big change from what we're currently doing?
So at this stage, I don't know any major details about it. I know that there was a draft idea at the state to sort of provide levels of openness within Safer at Home. But I don't think any details have been released, and I don't think I don't know of any sort of public outreach side to that. So Lane, maybe you know more than that.
I know that there is a draft, as Jesse mentioned, but we have not seen anything finalized. I don't know if that's what they meant by a dial. There's sort of a chart or a table, but I'm not sure what they meant by the dial. I don't know so to make sure we're actually answering the question that they had. There was some outreach related to certain sectors. I think arcades, there was an effort to try to reach out to those kind of businesses and thinking through, are there ways to potentially allow them to reopen under Safer at Home? Right now, I think there's some effort to look at tourism for the fall and winter, specifically, I think looking at like our ski resorts. So hopefully there's getting some input before those things get finalized. But again, I'm not sure what they meant by a dial. I don't think I've seen that to know what that is.
Feels like it's just another way of communicating the Safer at Home, stay at home, and protect our neighbors in a different way to communicate to the public. But we'll as more information comes out, we'll make sure we're clear and concise as to what it is that we're communicating. And if it's any change, we'll let you know. And if it's no change to what we're currently doing, we'll also let you know so that you're not surprised. And I think that's the key to all of this, is that when it gets introduced and there's new things, we want to continue to have sessions like this so that you understand how that relates to you. So I got a phone call just before this, and so we're going to take a little bit of a veer to another industry. I got a phone call just before this from a hair salon that's still unsure as to whether or not they can blow dry, especially as we move to colder months. You know, we had a snowstorm yesterday and had people walking out without blow drying, but now want to know, is it safe to blow dry a customer before leaving? And I didn't see anything on any of the sites that say do not blow dry on either Dora or on personal services, but wanted just to check in with you on that.
I'm not aware of any prohibition there.
Nope.
So.
Okay, So we have it on video, and I'll send this video off to the person as well. So I think there's a little confusion about the spacing of tables in a restaurant. I think on the restaurant and food service call 2 weeks ago, there was whether or not the tables need to be 6 feet or the patrons need to be 6 feet apart. Lane, could you give a little bit more clarification as to how far apart you need to be in a restaurant setting?
Yeah, and so the intent is for separate dining parties to be at least 6 feet apart. So how the safer at home language reads is patrons in different parties must be a minimum of 6 feet apart, and the spacing of tables may need to be 6 feet or more to ensure that proper physical distancing between those diners from different parties is maintained. So it isn't 6 feet apart for the tables themselves, and then you add chairs, and then you add people, and then you pull the chairs out, and now people are only a few feet away. So it does need to be spaced so that where the patrons are sitting, they are at least 6 feet apart.
Okay. All right. Do we have any other? I have another question coming in, so I will ask that question in just a minute. Are there any additional guidance on elevators? How elevators and the cabins and shafts need to be clean, or how HVAC systems need to be pressurized in the design of elevators, specifically when we're talking about healthy designs and HVAC systems and cleaning?
There's nothing in the safer at home orders about that. I would definitely check OSHA, Occupational Safety and Health, no, I think it's Health Administration. They may have specifics on that, but nothing in the public health order specifically about that. I would just recommend, like you're cleaning other surfaces, continue to clean that space. And obviously making sure that the air filtration and air systems related to that are up to date, have been inspected and all that. That's important.
And Boulder County's PACE department did a great webinar on HVAC systems, airflow, and all of that. I think it was 2 weeks ago. And one of the updates I was going to provide this week was actually a link to the recording to that webinar, because I know a common question, one that I never knew I would be asking in my career every week, was around HVAC systems in the first couple weeks. So they got experts on to talk about HVAC systems and air ventilation and movement of air to make it safer and more environmentally friendly. So I will send that out to everybody. Sorry, still have that cough. So we're going to switch gears now to events. So this wasn't really widely publicized, but it appears that there was a slight change in events, indoor events, where that if events can now fully follow the restaurant guidelines for the entire event, they may now operate as a restaurant and follow those guidelines and capacity restrictions. It now says that on the state website. So this means that parties are seated, there are no shared activities, and any performers are at least 25 feet from patrons. But if, just as you guys had been mentioning in the past, this was kind of not actually dictated on their website, but now it is dictated that events that do follow, kind of that restaurant ambiance, that idea that you're sitting at a table with a party, you're not moving around, you're just staying there, that they can officially now follow the restaurant guidance. And I just wanted to see if you had anything else to add there, or if that's something maybe we should send out to our event planners, just to see if that, because I think one event planner brought it up because they noticed it in just passing.
I don't know that that's a change, but yeah, so if there is food offered as part of an event, it does need to follow the food section. So, and people need to stay seated. So I think that is something that I think we have shared in the past. And specifically, events can't then also have like dancing and other kind of commingling kind of activities. So, but yes, they would need to follow the restaurant requirements. And then as far as capacity indoor, it would again be back to what they can fit within those spacing guidance for tables, with again a maximum based on either the space calculator or 100 is the maximum indoor for a single room.
So in that case, are they following the space guidance of the restaurant, or are they following the space guidance of the events?
If it's acting as a restaurant, then again, the capacity is still going to be 100, but if they can fit that many with those restaurant spacing. So no more than 8 people at a table, and then the separate parties must be a minimum of 6 feet apart.
And then if they have that performer, they need to be 25 feet away. And a performer includes people on a stage speaking loudly, including people that are giving speeches and so forth, because there's a projection of voice. Okay, are there any other questions for, oh, we do. What is the current locker room and shower guidance for a pool?
You know, locker rooms are allowed to be open. They need to be cleaned regularly, but I will look quickly and see if I can give you any more details on exactly how you would need to operate that. I mean, it would be similar to any other restroom type facility. You need to make sure that 6 feet can be maintained at all times. And that's why a lot of places are not opening their locker rooms, because they're unable to ensure that inside those locker rooms 6 feet is being maintained. 6 feet of social distancing is being maintained at all times. So it's sort of more of a, how do you do oversight in a locker room than it is in a locker room specifically a space that's allowed to be opened.
But the guidance hasn't changed for personal rec and the indoor rec on locker rooms.
Mm-hmm.
And that's for the pool areas, you're going to follow the personal rec guidance for locker rooms. In a lot of cases, it's shutting down a certain number of lockers in order to maintain the distancing within the locker rooms, increasing the amount of times it's cleaned and so forth.
Mm-hmm.
Are showers open?
I think Jesse mentioned this, it's where you're making sure your spacing still is a minimum of 6 feet. So that would mean you would need to close off shower stalls or shower heads, urinals, so you don't have it so that people can be next to each other. They need to be at least 6 feet apart.
Mm-hmm.
And then certainly making sure you're increasing your frequency of cleaning.
So we had another hairdryer comment or question. And it was just a comment that hair dryers do increase airflow and can spread particles farther. So that it's one of those things that people should just take caution with and make sure you're following safety, making sure you're continuing to follow all the other safety precautions within your facility. Continue to wear your masks, continuing to have to have spacing. And if you're uncomfortable drying hair, don't do it. It's not a requirement. If you do not feel comfortable having hair drying in your facility, it is not a requirement that you have it.
And I think we were pretty clear that it is not prohibited. I don't think we suggested that we're encouraging it or saying that it's safe. So, but we are not here to tell you laws that are not actually there. So we do have recommendations, at least for fans, oscillating fans and that we do not encourage people to use those for that exact reason, but there's no prohibition that we're aware of that says you cannot use a hairdryer.
Yeah. All right. Are there any other questions out there? So I have sent the EEOC guidelines to the person who asked that question, and I'll resend it. I'll send the HVAC. I'll send the HVAC video out to the entire group because it's a nice reference video that was done outside of these webinars. As a reminder, next week we'll be doing places of worship as a extra session. So if you know anybody in a place of worship, it might be a nice. And it's our first time doing places of worship, so it should be a good session, getting a lot of questions answered. If you have any questions in between these sessions, please do not hesitate to ask them. As you can see this week, we covered quite a few different industries, so there is no limit on the industry questions on them, and we'll continue to have these sessions weekly to answer your questions. All right, well, we'll give everybody back about 8 minutes, and we'll see you next week for the cross-industry session at 3 o'clock and the places of worship session at 4 o'clock. Have a wonderful weekend. Stay healthy, stay safe, and continue to do this for our economy and for our health. Thank you, guys.
Thanks, Corinne. Thanks, Lane. Thanks, everybody.
Right.